So I'm always asked, well, what's new and exciting in your field of laser cataract surgery, refractive cataract surgery? I think I mentioned a little bit earlier about the use of our lenses called the multifocal lenses. This is technology that's been around since the 90s, but really wasn't put into widespread use until after 2005. It was a matter of getting appropriate calculations and also taking out, I guess you could say, some of the bugs of the technology where originally people had really horrible problems at night. Now we've been able to really minimize that. We're probably on 5th to 6th generation multifocal technology, and also a technology similar to that called extended depth of focus technology. And here at our center, we're extremely blessed and fortunate to be involved in 2 studies of a lens called the Odyssey lens from Johnson & Johnson, which hasn't even been released to the public yet. And that, for many of us, has become our go-to lens. It is probably the most full range of vision multifocal lens with the least amount of side effects at night. Similarly, the Johnson & Johnson company, among others, are coming out with what are called extended depth of focus lenses, which are already out, but they're more and better of these technologies that minimize some of the nighttime glare and basically don't split an image like a multifocal lens, but actually make it so that your focal point far away that used to end when you get up to computer distance now literally gets extended to where you can even do some reading. So again, which one is better? Much of that is dependent upon you. When we meet you, when we see you, what you've had done to your eyes, like previous surgery or not, like previous injuries. Everybody has different eyes. We have a different technology where I use the expression, we don't want to stick a square peg in a round hole. We want to really put the square peg in the square holes. Another one of these wonderful technologies is called the light adjustable lens. An excellent technology for folks, particularly ones who've had previous LASIK surgery, RK surgery, PRK surgery, and even for patients who are used to doing what are called monovision. Some of you have probably used monovision with your contact lenses. One of your eyes was set for far and the other for near. I usually use the explanation when patients ask me, well, couldn't I get that Odyssey lens and just have both eyes do it? And much of it is more common sense than you would imagine. Somebody's brain that's made an adaptation and said, yeah, I've been doing monovision for the last 40 years and I love it. Why do I want to change that? So I can dial in a perfect prescription for distance and a perfect prescription for near with that light adjustable lens. So again, different strokes for different folks.